The hearing will come to order. We're gathered today in the Aging Committee to discuss the critical need to lower costs for families to get Americans back to work and to strengthen our economy. For too long, our nation has viewed caregiving as a personal problem limited to one family and expecting those families to figure it out on their own. American families now are silently struggling to find and afford reliable, high quality care that enables their loved ones to live independently. Today, our witnesses will speak about the importance of home and community based services for seniors and people with disabilities and the investment American families across our nation desperately need. Brandon Kingsmore and Aileen Shaheed will testify about how these services have changed their lives. They'll talk about how home-based services make it possible not only for them to live, but to thrive. Brandon and Aileen are not alone. More than 3 million Americans are able to remain in their homes and stay active in their communities because of home-based care. But at the same time, almost 820,000 Americans are languishing on wait lists for these services, sometimes waiting not just weeks, not just months, but years waiting for these services. This limited access to care hurts more than just those in need of services. And underinvestment in caregiving affects all of us, and it even hurts our economy. Without access to this care, many people, usually women, are forced to leave the workforce to care for a loved one. An investment in home-based care is an investment in families and our nation. It'll help get people back to work. It gives families something that is, I believe, immeasurable: peace of mind. The peace of mind of knowing that their loved ones are cared for. This kind of an investment will also give home care workers, the majority of whom are women from communities of color, a much needed and long overdue raise. These workers provide essential care. An investment in home and community-based services would give these hardworking women, or I should say mostly women, the opportunity to better support their own families and their communities. Last June, 40 senators introduced the Better Care, Better Jobs Act, Senate Bill 2210. I'm proud to lead that legislation in the Senate, which has earned the support of over 800 national and state organizations. This bill is an investment in better care for home care workers, better jobs for home care workers, better care for seniors and people with disabilities, and better support for those family caregivers I talked about earlier. This investment is about services and jobs. Over 100 top economists and public policy experts have said that investing in home care will help the United States maintain a competitive workforce. The leading economic analysis firm, Moody's, found that, quote, long term, the economy receives a lift from this policy as it supports higher labor force growth, unquote. This investment is what makes sense for families, what makes sense for workers, and what makes sense for our nation. So it's an investment that's needed now, not 10, 20 years from now. We need this investment now. The committee has received over 335 statements, for the record, that support the need for immediate investment in home and community-based services. So I look forward to the hearing today and hearing from our witnesses about this important issue. And Ranking Member Scott, I'll turn to you for your opening remarks.
Thank you, Chairman Casey, and thank you to the witnesses for being with us today. This is such an important topic, and I'm so thankful that Chairman Casey has decided to make this one of our priorities for this day. Without any question, you think about the fact that we have 46 million Americans today over the age of 65 living in the U.S., and just a few years from now, by the year 2050, that number will go from 46 million to around 90 million Americans. That is astounding growth that we should anticipate. By 2030, 1 in 5 Americans is projected to be 65 years or older. Nearly 90% of our seniors want to stay in their own homes as they age. To do this, seniors often turn to the support of their family members. And when I say that, I'm going to talk about how 44 million Americans provide every year around 37 billion hours, B as in boy, billion hours of assistance to family members. That to me is astounding. And it's a number for us to digest, but it's really hard to understand how important staying in your own home is and the cost, maybe not just financial costs, but the human cost of providing that care at 44 37 billion hours a year. Family caregivers provide over 75% of caregiving here in the United States. That is a significant investment into our loved ones, and it's an important investment, and one that we should take a look at and find ways to make that support better. The Build Back Better proposal relies almost exclusively on funding long-term care through Medicaid. That path, of course, is going to be quite challenging for so many families. The qualifications for Medicaid is significantly a hard threshold to cross over, which requires you to eliminate most of your resources. So that means that we need to look for other solutions. A better path forward would invest significant funding in a push for a self-directed care approach. This would give caregivers and recipients the means to make informed decisions about the services they need while providing resources to do so. Last June, I released a report expanding opportunities for older Americans, self-directed home and community-based services. So we looked for solutions in the report so that we could understand and appreciate what actually would be beneficial for families providing those 37 billion hours on an annual basis. And some of the solutions that we talked about was encouraging state Medicaid programs to establish self-directed care options. In addition to that, growing the long-term care insurance market. This is a critical piece. The earlier you purchase this insurance coverage, the cheaper it is and the longer it will last for most American families. Empowering the nation's volunteer army of 53 million family caregivers through sustainable funding that will improve conditions for caregivers while enhancing service quality. I've been around amazing caregivers all of my life, frankly. My mother is a nurse's assistant. She's in her 49th year of full-time employment providing care. She loves what she does so much so that it is, in fact, her mission. And so understanding and appreciating firsthand the struggles, the challenges, and the rewards of caregiving is undeniable in the household that I grew up in. And frankly, as I see my mother on the weekends when I'm back in town, she talks about how important it is for us to address this issue. It's one of the reasons why, Chairman Casey, I'm so thankful that we are having the hearing that we are today.
Ranking Member Scott, thanks very much for your opening statement. Now we'll introduce our witnesses. The order we had it in, Ranking Member Scott, is you would do the first introduction. Is that correct?
Yes, sir.
Okay.
My first, thank you, Chairman. Last month, we held a hearing on how to improve care experience for people enrolled both in Medicare and Medicaid. We call this the dual eligibles, and this is such an important part of the folks that we're talking about today, are those folks who are dual eligible for both Medicaid and Medicare. We heard from a witness representing South Carolina's Department of Health and Human Services. She described consolidating 10 Medicaid home and community-based services over 5 years. Too many waivers create confusion and administrative burden for both patients and providers. Our witness today has witnessed an important report describing how Congress can help states avoid this unnecessary complexity. Lisa, I'm going to butcher your last name. Lisa Harotutian is an associate director for the Bipartisan Policy Center Health Program. She is an expert on Medicaid policy issues, including long-term care and home and community-based services. Lisa is responsible for managing BPC's portfolio of work on long-term care, chronic care, integrating care for dual eligible beneficiaries, and other issues impacting individuals with complex needs. Lisa's been with BPC for almost 3 years. She previously worked for Virginia State's Medicaid agency, where she researched and analyzed issues impacting the Medicaid program. Lisa holds a Juris Doctor, a Master's of Social Work degree, and is a member of the Virginia State Bar. In her testimony, we will hear Lisa explain the Bipartisan Policy Center's proposal to make it easier for states to streamline and simplify these home and community-based service authorities. We look forward to hearing your testimony, and I apologize for mispronouncing your last name.
Ranking Member Scott, thank you. I think my notes say you got it right, so
Okay,
hope I'm right about that. We'll
fingers
double check.
crossed.
But thank you, Ranking Member Scott. Our second witness is Ann Tomlinson. Ann is a national expert on health and aging, assisting states and providers on policies involving health and elder care systems. She's the founder and CEO of ATI Advisory, a leading national research firm. I'll move next to our third witness, Brandon Kingsmore from Allentown, Pennsylvania. Brandon is currently a recipient of home and community-based services. His care worker, Lynn Widener, has also joined us today. Brandon receives home care assistance from Lynn, which enables him to live independently. After trying other careers, Lynn found her true passion in healthcare, working as a full-time caregiver. Both Lynn and Brandon have been staunch advocates for the importance of these services, and they've worked along with me and our office and others to make the case about funding these services. And recently, just I guess back in October now, both Lynn and Brandon were in Scranton, Pennsylvania, my hometown, and during a visit of the President of the United States. And Brandon and Lynn were able to spend some time talking to President Biden about how Lynn's care helps Brandon every day. And that was a revealing moment for so many of us who were there at on that day. So we want to thank both Brandon Kingsmore and Lynn Widener for joining us today. And then finally, our fourth witness, as I'm including Lynn and Brandon as one witness. I think Brandon might do most of the talking here, but we'll hear from both. But our fourth witness is Aileen Shaheed. Aileen is from Jacksonville, Florida. After working 30 years in retail, she retired but returned to work in her 60s as a security guard. As a result of a spinal cord injury, Ms. Shaheed lost the ability to walk. She now receives 20 hours of home care, allowing her to live safely and independently in her own apartment, cut back from the 35 hours a week before the pandemic. So, Ms. Shaheed, we're also grateful for your testimony today, and grateful you're with us at this hearing. So now we'll turn to our witnesses. We'll begin with Lisa Harutunian, and you may begin your testimony. And please correct us if we mispronounced your last name.
Thank you. Good morning, Chairman Casey, Ranking Member Scott, and distinguished members of the committee. Thank you for inviting me to testify today about a bipartisan pathway to improve the availability of Medicaid home and community-based services. I commend the committee for considering this critical issue through a bipartisan lens. My name is Lisa Harutunian, and I'm an Associate Director of the Health Program at the Bipartisan Policy Center, a nonprofit organization that combines the best ideas from both parties to promote health, security, and opportunity for all Americans. Today, I will cover the importance of improving access to Medicaid home and community-based services, key challenges created by the current patchwork of HCBS authorities that states use, and BPC's recommendation to address those challenges. Expanding access to home and community-based services has historically received bipartisan support, and Congress has made meaningful progress toward improving the availability of those services since the program began. However, the need for these services persists, and it will continue to grow as the population ages rapidly. In addition, the high rates of COVID-19 infection and mortality in congregate care settings have exacerbated the need for home and community-based care options. And for individuals with functional limitations or cognitive impairment, HCBS have long played a critical role in allowing Medicaid beneficiaries to live independently and to work. Together, these factors have brought national attention to the need for better access to home and community-based services. Before I discuss BPC's recommendation to improve access to HCBS, I would like to first highlight some of the challenges in the current system that we sought to address. Historically, states have predominantly relied on 1915C waivers to provide HCBS because they allow states to target services to certain subpopulations and to certain regions. States may also cap enrollment, and together this all allows some budget predictability for services. States often use multiple 1915C waivers, with each state using an average of 5 waivers, and some states relying on up to 11 waivers at once. In addition, states also provide HCBS through 1115 waivers and state plan options, including 1915I, J, and K state plan amendments. This patchwork of HCBS waivers and state plan amendments that states use have led to 3 key barriers to the availability of these services, including first, a system that is extremely complex and burdensome for states to administer. Second, HCBS programs that are challenging for beneficiaries to navigate. And third, inequities in access to HCBS both within and between states. So, what can we do? To address the growing number of Americans who need assistance with daily activities, but who prefer to receive care in their home or community, continued bipartisan collaboration is necessary. As described in BPC's report, Streamlining and Simplifying Medicaid HCBS Authorities, Congress should consider a bipartisan pathway forward that would improve the administratively complex and piecemeal structure for HCBS authorities. To this end, BPC recommends streamlining and simplifying Medicaid HCBS waiver and state plan authorities into a single state plan amendment that retains much of the flexibility of existing authorities. This would reduce complexity in the system while still providing states with budget predictability for HCBS. Ultimately, this change should improve access to services for Medicaid beneficiaries by reducing administrative burden for states managing HCBS programs, making it easier for beneficiaries to navigate the system, and helping to make services more uniform from state to state and across subpopulations in a state. While BPC's recommendation to simplify and streamline Medicaid HCBS waivers and state plan amendments would address several important challenges to HCBS access, we recognize that it would not solve all of the challenges to service access and delivery, but streamlining and simplifying these authorities could be addressed independently or as part of other efforts to reform the HCBS system. The enormously complex system remains a challenge to the availability of home and community-based services, but with your continued leadership and bipartisan collaboration, we can help more Americans access the critical services that they need to live independently and to work. Thank you once again to the committee for convening this important hearing, and I look forward to your questions.
Well, thanks very much, Ms. Haratunian. We are grateful for your testimony. I'm usually mentioned at the beginning of the hearing about senators being in and out of this hearing and other hearings and commitments they have. I know so far, Senator Warren has appeared at the hearing, as well as Senator Rick Scott, and I know others will be moving in and out as we move forward. So our second witness is Ms. Tomlinson. You may begin.
Thank you very much, Chairman Casey, Ranking Member Scott, members of the committee. Thank you for the opportunity to testify on the importance of home-based services to family caregivers. In addition to being the CEO of the Research Advisory Forum ATI Advisory, I am also the founder of a grassroots community of family caregivers called Daughterhood. Home and community-based services make it possible for many individuals with long-term services supports needs to remain where they want to be, which is in their homes. But unfortunately, our home care system and its infrastructure are vastly underdeveloped and under-resourced to meet the growing need for services. And if we don't invest in them, American families are going to face very serious economic challenges, possibly even more than they are today. What few people realize is that most older adults with high levels of need still live in the community, and many of those who do rely almost exclusively on family caregivers. Fully a third of high-need Medicare beneficiaries who are living in the community today with that high level of need are below 200% of the federal poverty level, and they are not on Medicaid, which means they can't access home-based care. And as a reminder, unlike nursing home care, federal Medicaid law does not require states to offer home and community-based benefits. And for older adults and people with physical disabilities, Medicaid still spends more on institutional care than on home and community-based services. And even among individuals with resources, finding and deploying even privately financed home-based services and supports is very challenging. These families report not knowing where to go and not being able to find what they need. So the good news is that states received a temporary infusion of federal funds for home and community-based services in the American Rescue Plan Act. But to stop here would be like bringing an umbrella to a hurricane. The number of individuals in our country who are 85 years and older will double by the year 2035. And that population, it's the 85 years and older who are much more likely to have high needs. And at the same time, caregivers available to take care of them are declining. So much more federal investment is needed to galvanize and support states and communities in developing the infrastructure and systems along which a variety of publicly and privately funded HCBS, home and community-based services, can travel. If we fail to make a sustained federal investment in home and community-based services, we will continue to rely heavily on unpaid family caregivers. And when they give out, nursing homes. And what I can tell you from my own experience, as well as being part of a community of unpaid family caregivers, this is simply not a sustainable path. Caring for a person who needs assistance performing daily activities is hard, full-time work. Family caregivers tell me all the time about how they quit their jobs or cut back. They spend less time with their children. They get sick. They spend their own resources. And often their only choice aside from quitting is a nursing home because they can't find adequate support in the community. As the growth in the size of this very old population starts to accelerate, our families, employers, communities, states will feel these strains in a really profoundly pronounced way. Investing in home and community-based services is one of the most impactful actions that we can take today to support individuals in need and their families in the future. Thank you again, and I look forward to your questions.
Ms. Tomlinson, thanks for your testimony. We'll now turn next to Brandon Kingsmore and Lynn Widener.
Thank you for having me and my caregiver, Lynn, here to speak today. My name is Brandon Kingsmore. I live in Allentown, PA. I've relied on home care my whole life. People don't know what's that like, so I share my story honestly and openly. But how many times will I have to tell the same story over and over before I'm taken seriously? I was born with cerebral palsy. Growing up, we didn't qualify for Medicaid, but we also couldn't afford to pay for home care out of pocket. Money was already too tight. My mom had to be a full-time caregiver on top of her full-time job. My sister shared the responsibility of taking care of me, and she also gave up a lot of her teenage years to do that. It was hard to think about what we would do if anything happened to my mom. On days on days when no one could be home with me, I spent 8 hours a day. I felt alone, trapped in my home. It was all I could do was to sit in one place, play video games, and watch movies. If something happened to me, I had no choice but to wait for someone to get home to help. For example, if I had to go to the bathroom, there would not be anyone there to help me. It was dehumanizing. Qualifying for Medicaid made a big difference. Home care opened my world and allowed me to do more. Home care is everything to me. My ability to live depends on it. Without care, people like me wonder, will I get out of bed today? Will I eat today? Will I be able to go to the bathroom today? Being in a wheelchair is hard enough. The world isn't built for people like me. Why do I have to fight for what should already be a basic human right? My life changed when Lynn became my caregiver. Lynn gives me the freedom to live my life the way I want, where I want. But not everyone is as fortunate as me. Millions of people can't afford or access care now, or they're on a waiting list. We become isolated, depressed, and removed from society against our will. All we want is to participate in our economy and community, but the choice is often made for us. The way things are now, we are seen as numbers, but we're not. I'm nobody special. I'm just a normal guy looking for a fair shot at a better life, but that shot hangs in the balance as you debate dollars and cents. This is not dollars and cents. This is this is life and death. Please don't make me tell the same story again. Home care workers give so much of themselves to give people like me a good life. I want caregivers like Lynn to have a good life as well. We have the opportunity to make history in this legislation. This could be a time for everyone to remember. This could change everybody's life and people like me as well. Please invest in PASS, Better Care, Better Jobs Act now. Thank you.
Good morning. Thank you for inviting me and Brandon to speak today. My name is Lynn Widener. I have been Brandon's full-time caregiver for 11 years. Recently, my mother fell ill, so I'm her caregiver as well. I have worked in long-term care for more than 20 years as a CNA in nursing homes and group homes and in-home care. So I can say with a great deal of expertise, our country's long-term care system is crumbling, especially after COVID-19. It's like the game of Jenga where you make one wrong move and the whole thing starts falling apart. So without the support of Congress, there's no money to expand and improve care services or to pay, train, and sustain the home care workforce. And if you don't have a home care workforce, then there is no care. And without care, there's no life. The demand for care is skyrocketing, but there's low pay and lack of benefits. They force home care workers to leave the industry. So policies like the Better Care, Better Jobs Act will make sure that every care consumer has their needs met by a strong care workforce. I'm fortunate to have something that many care workers do not, which is the right to join together in a union. And across the country, caregivers in our unions are demanding the changes that we need to provide the care that our consumers deserve. For all the victories that we've won over the years, there's a long list of injustices that we need to keep fighting for. Brandon was actually born before the Americans with Disabilities Act was passed. And that was a great start, right? But we still live in an ableist, ageist, racist, sexist world where people in need are being excluded and forgotten. And our country's leaders need to take a good look in the mirror and reevaluate how seniors and people with disabilities are treated. Home care workers, how home care workers are treated, how women and women of color who do the majority of this work are treated. March is Women's History Month. This is what better time than to turn collective appreciation for women into meaningful action that lifts us out of poverty and finally gives us, respect, protection, and pay that we deserve. And without the support of the entire Senate, we'll be back to square one. Caregivers will suffer because they can't afford food, shelter, healthcare. And there'll be no one left to help keep people like Brandon alive. We need better care. We need better jobs. We really need it now. Thank you.
Lynn, thank you. I want to thank you and Brandon for your testimony. And finally, our final witness for today is Ms. Shaheed. You may begin your statement.
Thank you, Chairman Casey, Ranking Member Scott, and members of the committee. Thank you for the opportunity to share my experience with you today as someone enrolled in the Medicaid home and community-based services. My name is Aileen Shaheed. I am 76 years old. I live in Jacksonville, Florida. I live alone and have no relatives that live in this area. In 2005, I retired after 30 years and started enjoying my retirement, traveling, visiting friends, and doing some of the things I wasn't able to do when I was working. I was also taking care of my nephew, who was with me until 2010 when he graduated high school. In 2013, needing more money, I went back to work and worked as a security guard in a private community. In 2016, I started to experience mobility issues. I went to the doctor and was told I had a growth on my spine. It took 2 surgeries to remove the growth, one in February of 2017 and the second surgery in July of the same year. After the second surgery, I was unable to walk and now need a wheelchair for mobility. I also require assistance bathing, dressing, housekeeping, some toileting, and meal preparation. I am enrolled in Florida's Medicaid long-term waiver, and I am approved for 35 hours of care per week. The assistance of the home health aide allows me to remain living at home, independent, and on my own with assistance. When given the option, I chose to receive services at home and not go into a restrictive nursing home where you're told what to eat, when to sleep, when to get up, and if you can have visitors. Since the quality of life, the services have been in decline. Oh, sorry. So I chose to live at home and not go into a nursing home because I value my independence. Come over here for a second, please. I value my independence. I am approved for help for 7 days a week of 5 hours each day. Right now, I can only find an aide for 20 of those hours. Since January of 2022, I have not been able to find an aide to come on Saturdays, Sundays, or Mondays. So I don't have any help for 3 days until the aide comes. This means I am unable to shower for 3 days. I can't take out the trash because I can't get my wheelchair in and out of the trash room. I'm only able to make easy to prepare meals on my own. A couple of weeks ago, I was fixing a cup of ramen noodles, tipped over the cup, and accidentally poured boiling water onto my leg and sustained a second-degree burn. Thankfully, I did not get infected, but the burn is on my leg, which I use for transfer and making it difficult to do it by myself. Not having the help affects every aspect of my life because the aides are my lifeline to remaining independent. I absolutely do not want to go into the nursing home. Why is this happening to me and thousands of others? It's due to the underfunding of Medicaid. The wages of the home care worker is too low. The average pay is $10 to $13 an hour. Since the pandemic, the aides are unwilling to come and risk their health and their family's health for just $10 an hour. So they went into private pay insurers who pay more and to jobs that pay more. The workers are hurt by how little they are paid. I am hurt by how little they are paid. Valuing me means valuing them, and valuing them means valuing me, and we all deserve to be valued. I know that there are many people in the same situation as I am that need these services, but we must have adequately funding. Thank you for allowing me to share my story with you today.
Well, Ms. Shaheed, thank you very much for your testimony and thanks for sharing your own personal story. We're grateful for that. We'll turn to our questions now, and as folks know how we alternate between both sides of the aisle, I'll start and then we'll go next to Senator Braun and then Senator Gillibrand. We'll go from there as senators appear. Let me just start. I'll just on this round ask one question. I want to start with Brandon Kingsmore. Brandon, I want to ask you about your story, a lot of which you shared with us today. You shared how home-based services has enabled you to live a life that is a substantial life. In fact, I heard you say that in Scranton back in October when you were talking to the president. I understand that without that care that Lynn provides you, that this kind of a life would not be possible for you. So many people across the nation are not able to receive the same kind of care that you're receiving. In your written testimony, you note that, quote, you don't qualify for Medicaid until you were 18 years of age because of how limited home and community-based services were where you lived. My question is, how important is it that we invest in home and community-based services across the nation?
Well, if you think about the growth of home care, it's growing in such a fast pace. I think home care right now is the fastest growing thing, and it's one of the fastest growing industries. And one day we're all gonna need help, whether we want it or not. But this is something that should be addressed. We should not be fighting for it in the 21st century. And my only goal is that people will understand that it's not about dollars and cents. This is about life and death. Without these home care services, my life would not be what they are, and I would not be the man I am today.
Well, Brandon, thanks. And the story you told about the concern you had about your mom who's working full time and providing care full time, I think is instructive for all of us that so many families are making those sacrifices. And the difference that Medicaid made in your life, as you said, made a big difference. We'll turn now to Senator Braun for his questions. Senator Braun. Maybe okay. Well, why don't we move to Senator Gillibrand?
Thank you, Mr. Chairman. I appreciate it. And thank you for holding this essentially important hearing. I really appreciate the topic. Some 20 million Americans already require long-term care, with roughly 10,000 people turning 65 every day. We will need to fill an estimated 4.7 million home care jobs by 2028. Today, more than 1 in 5 Americans are family caregivers, having provided care to an adult or to a child with a disability at some time in the last 12 months. It's clear that we need to ramp up our investment and improve the availability of home and community-based services and our care infrastructure for many more Americans. That's why I'm a champion of Sorry, that's Maple. That's why I'm a champion of Senator Bob Casey's Better Care, Better Jobs Act and its commitment to a massive care infrastructure investment, as well as my proposal for a national paid leave program. Ms. Tomlinson, how do the diverse needs of older adults and people with disabilities inform the need for improving availability of a wide range of home and community-based services? Does our care infrastructure and workforce meet all the needs from all people with disabilities? Are people falling through the cracks?
Thank you, Senator. That's a great question. It's almost a hallmark, I would say, of our patchwork, undeveloped system, these extreme inconsistencies in access across nearly every facet that you can imagine. So, across states, within states, rural versus urban, racial disparities, age disparities, accessing home and community-based services often can just be a question of, are you living in the right neighborhood, in the right state, with the right set of needs? The averages that we see in the national data, they mask really big differences, and overall just obscure the fact that certain populations are very much being left behind. Rural areas in particular struggle with supply of agencies and providers due to drive time. We see Black individuals using nursing homes that are lower quality a lot more frequently than white nursing home residents, and we see them lacking access to more private pay options such as assisted living. So this is it's very much a hallmark of our system. The unevenness of the access to services.
Yeah, that's what we've seen in New York as well. We know that again from Ms. Tomlinson, we know that paid family and medical leave, a crucial necessity for workers facing their own or their family's health issues, positively boosts the economy. We know that workers spend the wage replacement income they earn, which leads to further job creation and labor income for workers in various sectors. A widespread lack of paid leave disproportionately affects women, people of color, and low-income workers. Would you please describe how national paid family and medical leave might help address these overwhelming growing demands for caring support and long-term care?
Sure. So I'll just start first by saying that I have personally been away from work for an estimated month out of the last 3, very recently helping my 81-year-old mother take care of my father at the end of his life. And fortunately for me, I have access to paid leave. I'm the owner of the business, so I have a lot of control. I have wonderful coworkers who have covered my work while I've been out, but I am so far from the norm. And we are on the precipice of essentially having to build what I call a caregiving society. And I love what Lynn said earlier: without care, there's no life. I'm gonna use that and quote her often going forward, because this is what we will all be doing soon, whether we are paid or unpaid. We will be delivering care and receiving care. And even if we and when we succeed in making these new investments in infrastructure through the Medicaid program, families will still experience crises and other needs that require their attention. And if we don't have a paid leave, just must be the norm and not the exception, or we're going to just see even more sort of extreme economic insecurity as a result of having to make very, very difficult choices between work and taking care of family members.
Thank you. And just one question for Mr. Kingsmore. Thank you for sharing your experience. Could you describe how investments in care work and Medicaid home and community-based services translates to improved health outcomes?
Yeah, it would be great for both parties, both for the caregiver and the client, as far as money to pay for gas, better training, more opportunities. It would be better for the workforce because a lot of people quit the job because of lack of funding, or they don't make enough money, or the client. So if they had the proper things that they need, I do believe that the workforce would be better off and both parties would benefit.
Thank you very much, and thank you, Mr. Chairman.
Thank you, Senator Gillibrand. Before turning to Senator Braun, I just wanted to make sure that we acknowledge some folks. We're obviously acknowledging folks that have appeared at the hearing and have their camera on, and then some, they may have to leave and come back in a different order. But I know that we were joined earlier and maybe still by Senator Rosen and Senator Blumenthal. But we'll turn to Senator Braun, and then we'll see where we are with the next senator. Thank you, Senator Braun.
Thank you, Mr. Chairman. And my question is going to be for Ms. Haratunian, and it's going to be related to in 2020, federal government increased funding for Medicare and Medicaid, spending over 1.5 trillion on healthcare services. CMS has also issued waivers of federal requirements to expand beneficiary care access at this time. As a result, the GAO identified several risks to program integrity due to the suspension of these safeguards, increasing chances of fraud, waste, and other abuse. In your opinion, the drivers of healthcare spending and poor clinical outcomes for older and disabled Americans, has increased spending actually addressed in measurable ways, improving the outcomes? And has the suspension of, or the usage of waivers complicated matters as well? I'd like you to focus on the amount of money we're spending. Are we getting better outcomes since we're borrowing so much of it each year? And then weigh in on, waivers as well.
Sure. Thank you, Senator. So increased spending doesn't always equal better outcomes. It's important that spending be targeted in the right ways to promote quality outcomes. A lot of times ensuring that care is integrated, it's easy for beneficiaries to navigate and access, and ensuring that the delivery of those services is efficient and optimized, and that there's less complexity in the system can help make sure that those services are accessible and delivered in the best way possible.
And then what about, the waivers? What's that done to the complexity of trying to get everything to work as well? Would you comment on that?
Yes. So right now, as I mentioned, some states can rely on up to 11 1915 fee waivers, and that's just the 1915 fee waivers. On top of that, you've got the 1115 waivers, and then the variety of state plan amendments that states are relying on. This creates lots of complexity for states using multiple waivers and state plan amendments. They have to administer multiple programs and benefit packages with different eligibility, reporting, and other requirements. And each waiver is only for a limited time, and states have to periodically submit renewal requests to CMS. And given this variation in length of each waiver, those renewal processes can require significant staff bandwidth at the state Medicaid agency level, and it's burdensome for states. So, adding to the complexity of that, states also need to oversee multiple contracts and contractors, manage several waiting lists, and oversee different sets of quality metrics for each of these waivers.
And one final question. I've been a proponent since I've been in the Senate of reforming healthcare from the bottom up. Hospitals, insurance companies, practitioners, pharma, all of that amounts to about 18 to 20% of our GDP, depending on how you actually measure it. Most other countries are more in the neighborhood of 10 to 12%. In your observation, what are the most critical things you could do generally to make healthcare more affordable, whether the government pays for it or private insurers do to employers? What would be a couple, three things that would bring the cost down for everyone?
So one thing that we're focused on is, again, reducing complexity in the system to the extent that you can simplify and streamline those existing authorities that states are using and make those processes more efficient and less burdensome, have them require less staff time and less bandwidth to accomplish that. You can get greater outcomes and promote some better results there.
Well, very good. And I'd add to that I think the whole industry needs to embrace full transparency and competition. That would especially be helpful to fully insured plans and the private side of how we pay for healthcare. And I think it would address maybe some of the imbalances I see out there in terms of some providers saying they don't get enough for Medicare and Medicaid, and then through the private side of insurance as it weighs into healthcare, prices are exorbitant. So We won't solve it today. Thanks for weighing in on this component of it.
Senator Brown, thanks very much. I know we're waiting for a number of senators to either get back to the hearing or to get ready for questions. So I'll move to what is only my second question. I'm reclaiming some of my time from earlier so we can keep the hearing moving. But I wanted to turn to Ms. Shaheed. Your personal story is a great American story of hard work and sacrifice and overcoming so many challenges. And I just wanted to commend you for telling your story, because when you tell your own story, you not only inform us, but you inspire others to tell theirs and to move the ball forward on public policy. You talked about how home-based services keep you in your apartment and living an independent life, which you said is most important to you. You also noted, and I'm quoting you, I am approved for help for 35 hours of work right now. I can only find an aide for 20 hours a week. Since January of this year, I've not been able to find an aide to come on Saturdays, Sundays, and Mondays, unquote. So that's obviously a significant decrease, and as you stated, has led to you going days without receiving care. You also shared that as a result, quote, this means I'm unable to shower for 3 days, unquote. There's no excuse in the United States of America for someone living in our country going that long without basic care. And the tragedy here is that Washington has not responded, most recently, but over many, many years. And that's why we're advocating in such a determined fashion to finally, as a matter of national policy, to fund home and community-based services so that people have a chance to receive these services at home. You know, a lot of people may not realize, but we already made a decision decades ago to use the Medicaid program as a way to provide long-term care to families, right? And that is not limited to families that are low income. A lot of middle-class families benefit from Medicaid. They get their nursing home care. Middle-class families get their nursing home through Medicaid. I can't say that enough. I might say it again later in the hearing because people in Washington don't seem to hear it. It's not a question of whether Medicaid is going to provide funding for care, for long-term care. It's a question of whether Americans are going to have a choice to get the care in the setting that they want, the setting that's preferred by many, not all, but many, which is home-based care. So that's what we're talking about here. We're either going to validate that choice or we're not. Washington hasn't done that so far. So, Ms. Shaheed, sorry for that long prelude, but how would raising wages for workers impact the availability of home care workers that provide the type of care you receive? Aileen, I think you're muted, maybe.
Yes.
There you go.
Senator Casey, thank you so much for having this hearing and for bringing these issues to the forefront. Having the wages increase of the home care workers would give me a greater quality of life. I have my dignity suffers and my health suffers when I'm unable to shower for 3 days. I'm isolated. I'm not able to participate with the community here in my apartment complex because I'm not comfortable going in a setting with my friends and I haven't had a bath in 2 days. So the increase in the wages is the key. That is the key component as to why I do not have the help that I need. The wages that are being paid by Medicaid are too low. And the reason I haven't had a aide to come on those days because the case manager called 12 different agencies She called 12 agencies and was unable to find help to come on any of those days. So she called 12, then she called 5 more, but no one was available because no one is willing to work for those wages that are being paid. So the increase would increase my quality of life greatly. Thank you, Senator Casey.
Thanks for making that point and for being willing to share your own personal story. Wages matter. And if we really care about older Americans, if we really care about people with disabilities, we're not just going to have some policy. We're going to have a policy that lifts up the wages of those workers to accord them the status that we claim to accord them as Americans. Everybody says we care about caring for older Americans. Everybody says we care about caring for children, people with disabilities, and yet the people who are doing the hard work every day aren't paid a hell of a lot. $12 an hour is the average across the country. That is unacceptable in America. I'm turn next to Senator Rosen.
Well, thank you, Chairman Casey. I can't see if Ranking Member Scott is there. Thank you as well for holding this important hearing, for the witnesses for being here today, for being willing to share your stories and do the work that you do. You know, I'm a former caregiver for both my parents and in-laws, and so I understand the important role caregivers play in helping their loved ones continue to live independently in their own homes and even be able to thrive if they're in nursing homes or assisted living or memory care, as my mother-in-law was. And so I've heard from constituents across Nevada, including caregivers represented by SEIU, about the many struggles of being a caregiver, a full-time and physically and emotionally demanding job. That's why I was so proud to stand with Chairman Casey in co-sponsoring the Better Care, Better Jobs Act, which among other important things which support the HCBS workforce, including by significantly strengthening worker protections. I also co-sponsored the Credit for Caring Act, which would provide caregivers with a federal tax credit of up to $5,000 to cover expenses associated with caregiving. You're caring for a loved one, parents and in-laws like I was, that could make all the difference for a family. So building on what all of my colleagues have mentioned here, Ms. Widener is a home care worker represented by SEIU. Can you tell me how you feel about having those worker protections, union representation that supports you on a day-to-day basis? And what else do you think that I can do here in Congress, or all of us can do, to prioritize to work on both the economic and mental and emotional support to caregivers like you who are going in to so lovingly help others live a productive life? It's just invaluable what you do. So, Ms. Widener.
Thank you. So the first thing I'd like to say is that sometimes home care can be extremely isolating. We work by ourselves. You know, we disappear into the background sometimes because we're in people's homes. We're not in a facility. There's no like people touring. One of the things that I noticed specifically for myself is I worked in 2 different states in home care in North Carolina, and then we moved here to Pennsylvania. In North Carolina, I didn't know any other care workers. I was completely alone. When I moved to Pennsylvania, I found out that there was a home care workers union. And in joining the union, I found a community. My union siblings are my friends and my support. Honestly, I don't know how I would have survived the pandemic and all the anxieties and lack of resources without them. We were mailing gloves across the state to each other. We were sharing masks if somebody knew how to sew, because those resources are really hard to find. So far in Pennsylvania, we were able to start a training program. We were able to help home care workers learn skills we need to keep ourselves and clients are safe. This is because of the advocacy of the Home Care Workers Union. It didn't exist before we had to start fighting for it. Congress needs to prioritize passing this funding, because we can't, think of this as like just individual elements. We need to tackle everything all at once, right? It'll direct more funding to programs that are directly supporting us, like, wages and training and accessible care. In our union, we were able to win this year 8% raises for home care workers. And that is something, I really appreciate, but I am now bumped to $13.50 an hour. It's still not enough. I can walk to Taco Bell and make $15 an hour, but if I have a human life in my hands and if I'm providing them care, it's $13.50. Does that mean that my labor is less important? I don't think it does. I think that we're important. I think that we need to increase funding so that we can make sure that not only the workers are taken care of, but also our consumers. Thank you.
You know what? I think you hit it right on the head there. You are important. The work you do is important. You talked about community and having a network of people that you work with so that you can learn from each other and grow. Community matters. It matters for the people you care for, and it matters for all of you workers. I know I just have a few seconds, so I'll take my answer off the record. But what I was going to ask Ms. Shaheed is about lack of standardized workplace protections for people who work in home care centers. Ms. Widener, and it's unfortunately a transient field with high turnover, and there's really a burden in finding new caregivers and making sure they have the protections when they go into someone's home to care for them. So I'll take my response. We'll submit these for the record. I appreciate you all being here, and I will support you every way I can. I know what it feels like. And I know what it means. I know what it meant to my family, and you always will have my support. Thank you.
Senator Rosen, thanks very much for your questions. I know we're going to be turning to other senators as they appear. In the interim, I wanted to pose a question to Ms. Tomlinson. In your testimony, you talked about your work with daughterhood and gaps in services for family caregivers. You noted how that compelled you to develop a platform to connect family caregivers with one another and to connect them to other resources. As we noted earlier, over 53 million family caregivers across the country are taking care of their loved ones, including 1.6 million in my home state of Pennsylvania. While many Americans gladly take on these responsibilities, it's really an act of love that they take on these responsibilities over and over again. Family caregivers often shoulder many, many burdens. I can't even imagine. I haven't never had to do it myself, but so many have. So these burdens can include enormous financial costs, lost wages when they leave the job that they're in to care for a family member, a loved one. They can also forego, and often do forego, promotions at work because they're not there. They're home, or they're in a family member's home taking care of them. Some are forced to leave the workforce altogether. So, Ms. Tomlinson, how would an investment in home and community-based services fill some of the gaps in care and enable family caregivers to return to work?
Thank you. Thank you for that question. So I always say when I'm talking to people about what it's like to be a family caregiver, it's really like all across the country right now, every single family is essentially building and creating an entire system of care delivery from scratch, all alone. That's what everyone is doing right now. It's like we're homesteading long-term care, essentially, in this country. And so this investment, and I love that word because it implies that we are preparing strategically for the future. Not just throwing another, Band-Aid on the problem. We are thinking strategically as a federal government, as a state, as a private sector about what we need to do to prepare. And there are, when I talk to family caregivers, there are what essentially what they need is what I call and what we would invest in. I think as a country is kind of the four cornerstones of the infrastructure, which is an increase in the services that are available to individuals who qualify, but more importantly, reforming the eligibility system so that we do a better job of identifying people who have financial and functional needs so that we can qualify for them for services in the first place. Obviously, we've talked about this, many others have talked about this, the importance of workforce and compensation and wages and training in order to prepare the workforce. That's a huge gap that the families are dealing with. And then for everybody, not just Medicaid beneficiaries, but for everyone in the country, we have to build a strong infrastructure so that there is a place to go in your community where you can be supported and helped along the journey, regardless of how you're paying for the services.
I appreciate that. Thank you. Senator Warnock, we're joined by Senator Warnock. Thank you.
Thank you so very much, Chairman Casey. I'm glad to be here to address the issues facing the caregiving economy in our country. Home and community-based services, HCBS, helps older Americans and people with disabilities live independently and to live lives with dignity. This has been especially important during the pandemic, or at least the pandemic has pulled these issues into sharper focus. When older and vulnerable folks were able to stay at home with their caregivers, instead of being crowded, for example, in a nursing home, and nursing homes are an important part, obviously, of the ecosystem of care. But in the pandemic, home community-based services allow people to be at home and therefore to mitigate risks around COVID-19. There are tens of thousands of Americans who likely qualify for this service, but are not able to get it because the program doesn't have enough money. For example, in Georgia, we have about 8,000 older folks and people with disabilities waiting to receive this at-home care. For me, that is unacceptable. Ms. Tomlinson, I want to ask you about waiting or planning lists for HCBS. As you know, nearly every state offers at least one kind of HCBS waiver that allows folks to get care at home rather than in a nursing home. How can Congress get those 8,000 Georgians, folks I represent, off the waiting list and into care and services?
Thank you. Thank you for that question. These waiting lists represent real need and desperation among many families. Those numbers are really concerning. And the truth is, unfortunately, the even worse news is that if there are lots more people in need than are on even the waiting lists. So depending on the state, we may or may not really be measuring the true fact of unmet need in that state. So what states tell me is that the most important thing from their perspective in building up their systems and services so that they can serve everybody who has need and qualifies for services is having financial predictability, and having the sort of the certainty about the funding. And so I think from my perspective, the best thing that Congress can do to help Georgia and other states with meeting that unmet need that's represented in part by these waiting lists is to increase the federal match rate, to give them, essentially the money that they need. They are, for not just for funding the services, but also for doing the planning and the infrastructure development that they need to do to make sure that the delivery system is there to actually serve people when they come off the waiting list. So we have to have that kind of ready to go. So those two things are important, and states really need it. It's very, very hard for them to prioritize this from a staffing perspective or even from a budgetary perspective if they don't have that support from the federal government.
No, thank you so much, and I agree, and it's the reason why I'm so focused on this issue and engaged trying to co-sponsor the Better Jobs, Better Care Act, other pieces of legislation that would be helpful. Medicaid is the primary source of coverage for long-term services and supports in the United States, accounting for 52% of all spending on long-term care nationwide. And the majority of this spending goes towards the home community-based services program, which typically involves assistance with activities of daily living like cooking, bathing, housework, essential things. And this is obviously limited to folks eligible for Medicaid, meaning there are many in Georgia who are not able to receive this support because Georgia continues to refused to expand Medicaid, leaving hundreds of thousands of Georgians unable to receive these benefits. Mr. Kingsmore, you are currently a recipient of Medicaid HCBS. What would happen if you lived in Georgia and were not eligible for these services?
I would be in a home. I would be trapped in a system that didn't care. People get shoved in a corner and unable to live the way they want or how they want. I'm glad that I live in Pennsylvania, but we're supposed to be the greatest country on the face of the earth. This something needs to be done, especially to the older generation, because we're important too. We're not supposed to be stuck in a home or trapped in a system that don't care about us. We are supposed to be the greatest country in the world, being prepared for something like this. And this has been going on for far too long, and it needs to change.
Thank you so very much. And what you describe as what would be your situation if you lived in Georgia is the situation of a number of Georgians. So thank you for your voice and courage on this. And it's the reason why we've got to continue to try to find a fix. 10 years after the Affordable Care Act was passed, Congress has to close the loop and make sure that people have access to Medicaid, especially including folks who could benefit from home-based care. Thank you so much.
Thank you, Senator Warnock. We appreciate you being here, and thanks for your advocacy. We'll turn next to Senator Warren.
Thank you, Mr. Chairman, and thank you for holding this hearing and for your steadfast advocacy on this. You know, we know that the majority of adults and people with disabilities want to live at home. We also know that chronic underfunding of home-based services has taken this option off the table for many, and it's left hundreds of thousands of people on wait lists all across this country. The failure to invest in home-based services not only harms people who need care, it also harms the workers who deliver it. Home care workers, who are more likely to be women and people of color, earn a median wage of just $12 an hour, and they are 3 times as likely to be in poverty compared to other workers, and they are less likely to have employer-sponsored benefits like healthcare and paid leave. The COVID-19 pandemic has made these challenges even worse, as caregivers have delivered essential services in jobs where social distancing was nearly impossible and personal protective equipment was alarmingly scarce. Ms. Widener, you've shared that as recently as last year, you were earning $12 an hour as a home care worker. Can I ask you to say a word about how that has affected your financial security?
Yes, thank you. So the low wages in home care have been really difficult. It usually means I need to work more than one job to make ends meet. I'm working more than 80 hours a week. I don't have days off. I get paid 8 hours a day, but I really provide 24-hour care. And a lot of that means that I end up in a lot of debt. A lot of it's medical debt, but there is others as well. And it's nearly impossible to climb out of that debt when you're living paycheck to paycheck. It's emotionally, physically taxing, and then having that financial stress looming over you just makes it that much harder to get in the correct headspace to complete my job the way I want to.
Wow. Well, I very much appreciate your sharing that. You know, under these conditions, it's no surprise that states are reporting a shortage of dedicated home care workers. And despite the growing demand for home-based care, the turnover rate in direct care jobs is as high as 60%. Ms. Shaheed, you've spoken about the shortage of home care workers where you live. How has this affected your ability to get the care that you need?
Senator Warren, thank you. You're asking how has the shortage affected me?
Uh-huh. The shortage greatly because I'm unable to access without the home health aide coming into my home and assisting me with my daily living. My world comes to it slows down where I'm not able to access outside of my front door because I'm totally dependent on them to do things for me that I am now unable to do for myself. So the shortage, get my quality of life goes downhill when I don't have the home health aide coming into the home to assist me with those things that I need to do in order to be living independent. The shortage is have just have things are not well because of the shortage of workers, and there is the shortage of workers because there is low pay.
Yeah.
And until that is resolved, we're going to, this will, it just continues.
Yeah. I appreciate your underscoring this. And I think Mr. Kingsmore said earlier that if he couldn't get access to home-based care, then he would be forced to live in a nursing home, or he would be back at home without the quality of life that he has now. I worry about the fact that too many people are forced into nursing homes or other congregate care facilities because they can't access the care they need at home. And the pandemic has just made clear how devastating the consequences of those decisions can be. As of January, 23% of all COVID-19 deaths in the United States happened in long-term care facilities. So right now, Congress is considering legislation that would make an historic investment in home and community-based care to ensure that more people can access these services. And that starts with treating home care workers like the essential workers that they are, by paying home care workers a living wage, by providing them with good benefits, by ensuring that they have the right to join a union. Ms. Widener, I know we're running out of time here, but can I just ask you just to say a word about what those investments would mean for you and for the people around you?
Yeah, absolutely. I mean, an increase in funding for home care would change absolutely everything, honestly. I mean, having access to a living wage and benefits, I don't know what a day off is. Health insurance is incredibly expensive for me on the marketplace right now. And most home care workers can't even afford it. So we're healthcare workers that go without healthcare. And it would mean turning home care jobs into a professional healthcare career. That means that we would increase the workforce. People would be able to stay in their jobs. And that means that people would be receiving care, the care that they need and the care that they want. Families need this investment, and care workers need this investment as well.
Right. Well, you put it very well, and thank you very much for that summation of what's going on here. Home-based care is essential infrastructure for families. These investments provide necessary financial security for home care workers. They ensure that more adults and people with disabilities live in dignity in the setting of their choice. And they would also allow unpaid caregivers who have taken leave from their jobs to care for a loved one to be compensated for their work or to return to the workplace if that's what they want to do. As our population ages, demand for home-based care is only going to increase. So the time for us to act is now. I am ready to join you, Mr. Chairman, in getting this done. Thank you.
Senator Warren, thanks very much for being with us today, and thanks for your questions and your advocacy. We have work ahead, and this hearing helps us light the path forward for that work. But thanks for working with us on this. And I don't think we have other senators who are waiting to ask questions. So in the interest of keeping everyone's time in a more efficient fashion, I think what I'll do is close and note for the record that we'll have the hearing record open. But I wanted to start by thanking each of our witnesses for their testimony today, and also for their willingness to appear and to tell their own story. It's not always easy to tell people about your own life, your own challenges, your own struggles, and we hope in some cases your own opportunities that you can be very positive about. But too many families are not provided the opportunity for these kinds of services, for home and community-based services, whether they're a senior or a person with a disability. So I wanted to thank our witnesses for being with us today and sharing not only their stories, but also their expertise, whether that expertise is gained personally through your own life or the expertise of long years of study of these important policy issues. But before closing, I wanted to highlight a new report from the Community Living Policy Center at Brandeis University. This report is entitled, quote, "Reducing Costs for Families and States by Increasing Access to Home and Community-Based Services." This particular report cites AARP data that indicates that 6 in 10 family members who have had to reduce or quit their employment to care for a loved one. 6 in 10 family members who have had to reduce or quit their employment to care for a loved one. So those numbers aren't just significant when you enunciate the number. You can see the impact it's having all across America. This means that these family members have had to reduce their family income to care for a member of their family. As I said earlier, it's an act of love, and they're happy to do it. But we shouldn't continue to put them in the position of having to reduce their income or having to leave their job. Lack of available care in America means these families that have this challenge will have less income and greater expenses. So increasing the investment in home and community-based services can send family members back to work. So I believe in the United States Senate, we have some basic obligations year in and year out. And among those obligations, I believe, are the following. We have an obligation to lower costs for families. Senators have an obligation to create jobs that will sustain families. And of course, we have an obligation to help Americans get back to work. All three of those obligations can be met for senators supporting a policy that will increase our investment in home and community-based services. Many people remember the American Rescue Plan passed a little more than a year ago, March of 2021, which included a new investment in a great American idea, home and community-based services. That was kind of the first new funding we had for these services in a generation. And that was just the start. But we need a much greater investment to make this a reality for so many families. As we've heard today, we've got to build on this initial investment in the rescue plan, and we need to do it now, this year, to bring relief to American families. So in the end, this is about all of what we talked about. It's about better care for seniors and people with disabilities. It's about better jobs for those who are doing that noble, essential, and heroic work, caring for folks in their homes or in the community. And it's also about providing a measure of relief to those tens and tens of millions of Americans who are providing care for a loved one every day, leaving their jobs, increasing their costs to do that. They should be the beneficiaries of the work of the United States Senate. So we're grateful today for our witnesses and for the senators who attended and for those who are lifting up these policies to have us as Americans not just meet the obligations that public officials have, but to create the America that we hope to have. We all say we care about seniors. We all say we care about people with disabilities. Then shouldn't we at least provide a measure of funding so that these Americans, who in many cases have worked their whole lives, and all they're asking for is an opportunity to choose the setting within which they receive their care, in the home or in the community. Some may choose to have their care in a nursing home or a long-term care facility of another kind. That's their choice. But that shouldn't be the only choice. And in America, unfortunately, for too many Americans, that is the only choice. So we have a long way to go. We have more work to do. But this hearing helped us lift up seniors and people with disabilities and their needs, and helped us lift up those workers who are doing this work and those families who are struggling every day. So thanks very much for your time, and our hearing is adjourned.